Assalamu alaikum, dear students. My name is Kamila Rahimjanova. I'm assistant of the Department of Obstetrics and Gynecology number 3. Our today's topic is bleeding in pregnancy. In obstetrics, we have three types of bleedings. First is the bleedings before 22 weeks of pregnancy. They are divided into two, not associated with pathology of the fertilized egg and associated with the pathology of the fertilized egg. Second group is the bleedings during labor in the first and second stages of labor. This could be due to placenta previa and premature detachment of a normally located placenta. Third group is the bleedings in the placental and early postpartum period, which could be due to hypoatonic uterine bleeding, retention of the parts of the placenta in the uterine cavity, ruptures of the soft tissues of the birth canal, and congenital and acquired disorders of the hemostasis system. Let's talk about the causes of bleedings that are not associated with the pathology of the ovum. It could be cervical ectopy, cervical canal polyps, cervical cancer, varicose veins of the vagina and external genitalia, and vaginal trauma. Ectopy of the cervix is quite common during pregnancy. Blood discharge is usually contact and not accompanied by pain. When treating such patients, the main task is to exclude cervical cancer, for which a speculum examination, colposcopy, and cytological examination of smears from the cervical canal are used. Cervical canal polyps can be single or multiple, of various sizes, with a stalk located at the edge of the external os or extending deep into the cervical canal. Clinically, polyps manifest as contact blood discharge. The diagnosis is established by speculum examination, and polyps also require surgical treatment, polypectomy by careful unscrewing with mandatory histological examination. Varicose veins of the vagina and external genitalia most often occur due to mechanical and chemical traumas. The source of bleeding is determined during examination and the damaged tissue integrity is restored. Okay, let's talk about causes of bleeding that are associated with a fertilized egg. We should divide them into three. It's abortions, ectopic pregnancy, and hydatidiform mole. Spontaneous abortions or miscarriages. In general, about 80% of all miscarriages occurs at the beginning in the first weeks after conception. Ectopic pregnancy is the attachment of the embryo outside the uterine cavity, for example in fallopian tubes. Hydatidiform mole is the pathology in which the chorionic villi degenerate into vesicles containing fluid. Let's talk about abortions. We have four classifications of abortions. First is according to the nature of the termination of pregnancy. We should divide them into spontaneous or artificial. According to the method of implementation, abortions are divided into surgical or instrumental and medical or pharmaceutical. And also we have classification by gestational age. We have early miscarriages that occurs before 12 weeks of pregnancy and late miscarriages that occurs between 12 and 22 weeks of pregnancy. Also we have classification by clinical manifestation is a threatened abortion, inevitable, complete and incomplete miscarriages. Threatened miscarriage characterized by nagging pain in the lower abdomen and slight bloody discharge while the cervix remains closed. Inevitable abortion, more intense pain and bleeding are observed. The cervix opens slightly. Incomplete miscarriage, part of the fertilized egg has already been released, but its remnants remain in the uterus, which requires medical intervention for removal. Complete miscarriage, the fertilized egg has completely fall and no further treatment is required. Here we can see threatened miscarriage, inevitable, complete, and incomplete miscarriage. Treatment for threatened and inevitable miscarriage. First of all, there should be complete, balanced, vitamin-rich diet, bed rest, non-drug therapies. We also should reduce psycho-emotional stress and relax the muscles of the uterine body. First of all, we should prescribe sedatives, infusion of valerian root in first trimester, tranquilizers in second trimester, also tocolytics, antispasmodics, which are metazine, nospanin, papaverin, baralgin, also salusa magnesium sulfates, and beta-adrenergic agonists. In the first trimester, the following also are used: gestogens for corpus luteum insufficiency. We can use dufastoni and utragestani. Gestogens plus estrogen for hypoplasia, malformation of the uterus with ovarian hyperfunction, corticosteroids, and symptomatic remedies like ascarotine and ditinol. Before an abortion, a woman must undergo analysis for viral hepatitis B and C, gynecological examination, analysis for syphilis, general blood test, HIV test, beta-HCG test, coagulogram, and general smear. Let's talk about hydatidiform mole. Hydatidiform mole is a disease associated with the pathological development of embryonic tissue as a result of genetic disorders. Here we can see hydatidiform mole. We have two types of hydatidiform mole. It's complete and partial. Incomplete, there are no fetal tissue in the uterus, only altered villi of the embryonic membrane are present. Partial, there are always fetal elements. This type of hydatidiform mole is less common. Here we can see complete and partial molar pregnancy. Let's talk about clinic. With a hydatidiform mole, there is a delay in menstruation, a positive pregnancy test, but also we can see pronounced symptoms of early toxicosis, discrepancy between the size of the uterus and the expected period of pregnancy, less than the norm for this period, bloody discharge, and bleedings. How we will diagnose molar pregnancy? First of all, the clinical picture during pregnancy is assessed. An ultrasound of the pelvic organs is performed. The absence of the fetus in the uterine cavity is determined in combination with a specific picture that's called snowstorm, or the presence of pathological tissue in addition to the fetus. Beta-HCG is determined in the blood serum. And how we will treat molar pregnancy? After the diagnosis is established, the molar pregnancy is removed from the uterine cavity in an obstetrics and gynecology hospital. For this, vacuum aspiration or curettage of the uterine cavity is used with mandatory histological examination of the biopsy material. After removal of hydatidiform mole, we should monitor blood tests for beta-HCG, ultrasound of the pelvic organs, and X-ray of the lungs. Ectopic pregnancy. This is the implementation of fertilized egg outside the uterine cavity. We have four types of ectopic pregnancy: tubal, abdominal, ovarian, and cervical. Signs of ectopic pregnancy, there will be also delayed menstruation, positive tests, early toxicosis, drowsiness, enlargement and soreness of the mammary glands, and change in the taste preferences. Causes of ectopic pregnancy. First of all, it could be chronic inflammatory processes of the pelvic organs, obstructions, the appearance of adhesions and tissue scarring, impaired peristalsis of the fallopian tubes, closed exit from the tube, endometrial pathology, past infectious diseases, congenital factor, and single fallopian tube. Risk factors is a history of ectopic pregnancy, adhesions in the pelvis, interventions of the fallopian tubes, intrauterine contraception, surgeries, bad habits, anatomical features, age from 35 years, and hormonal and endocrine disorders. How we will diagnose? First of all, we will check beta-HCG analysis. It's the only biochemical indicator for diagnosing ectopic pregnancy. While in a normal course, beta-HCG increase double every 2-3 days. In ectopic pregnancy, it would increase no more than 1.5 times every 2-3 days. An ultrasound for ectopic pregnancy at an early stage should be transvaginal to determine where the embryo was attached. It's advisable to conduct it 5-7 days after a missed period. Complications. Ectopic pregnancy could be complicated by interruption, by rupturing of the tube, and by tubal abortion. How we will treat? We have drug treatment and surgical treatment. For drug treatment, we will prescribe methotrexate For surgical treatment, we can do laparoscopy or radical surgery